Hi, my name is Aretha Brown. I'm a Lamar student from Joanne Gray Dishman Nursing School, and today I will be presenting to you my environmental risk assessment evaluation from Christus Hospital. So the first risk that I found was that the overhead communication speaker is not functioning properly. So with this not functioning properly, the hospital community is impacted. Like everyone in the hospital at the time of the communication failure is impacted. So that's the guests, the patients, and the staff. All of these people are affected. The overhead communication system must function properly to keep the community alert to what is happening in the hospital. Weekly outages affect the hospital's ability to ensure patient safety, the safety of the staff, and visitors. According to the Joint Commission Standard EM 12.2.2 EP4, the hospital will provide warning and notification alerts specific to emergencies and disasters and what procedures to follow during those occurrences. We should identify each alert or warning and the procedures to follow when activated. We should keep it simple and manageable. We focus on those that need immediate response, such as fire or missing person, code blue, active shooter, or severe weather. The initial alert should focus on the action that has happened or a situation that has occurred. This alert lets the staff and visitors know if they need to do something immediately to prepare for the situation or to protect themselves. And so, if the speaker is not functioning properly, we wouldn't have this kind of communication. The codes would be missed, and disasters could be happening, and no one around would know. It would be a miscommunication. The recommendations and measures for success. I recommend the overhead system be checked at the beginning of the workday and again at midday. This should decrease the occurrences from daily to once a week. An alternate measure includes using a color coded system, using the flashing lights to represent the important messages until the communication is restored. For example, for a code blue, we would flash blue lights, or for fire or disaster, we would flash the lights connected to those codes. The system could be connected to the fire alarm system to be cost effective. So just as whenever like the fire alarms, how they flash white and make sound, we would only flash the color. We wouldn't make a sound to go with it. Public education on the meaning of the lights would be provided if the system was implemented. This should reduce the alert fatigue that may occur if the system is constantly not functioning properly. Meaning that if it's always testing 1 2, testing 1 2, people will begin to ignore the system whenever it cuts on and potentially missing codes when it is actively working. And to measure that success of the alternate measures, a survey should be given to rate the success. If the results are 50% or greater, then the alternate is a success and you can keep it in implementation. Pharmacy medication field error was the second risk. So the Pyxis showed that the medication was loaded in a certain location and the location did not exist. So meaning that there was a pocket when I went to go get a medication and the pocket did not exist and the medication wasn't there, even though in the Pyxis it showed that the medication was there and that it should be in that Pyxis, it was not there. So this impacted the patient because it delayed the patient from receiving their medication promptly. This caused the nurse to delay care for the patient. She had to call and alert the pharmacy department that the pocket did not exist and that the medication was there. It also showed in the pictures that the nurse did actually remove the medication, seeming like it was taken to be given to the patient. So that had to be fixed as well. And the pharmacy department was impacted because they had to find the missing medication, research the error, and correct it. These types of errors could potentially lead to drug diversion. Recommendations and measures for success. I recommend that the pharmacy have a protocol for loading medication or limit the options of available space for medication. For example, only IV fluids should be loaded in the tower pockets, and that's where the medication was stated to be loaded. At the end of the week, a Pyxis audit of all medication loaded should be conducted. This will reduce the number of field errors 2 to 3 times weekly to once a week, because if you're doing an audit weekly, you can see what medication was supposed to be loaded and what was not, and you can actually go and check for the errors. The third risk was broken utilities in the patient's room. This impacts the patient's safety. It affects their comfort in the room and their health. While the patient is in the hospital's care, they should be provided running water, a functional bed, and a climate controlled room. If the room is too hot, the patient may experience heat exhaustion. If there isn't any running water, the patient cannot properly maintain their hygiene needs like baths, brushing their teeth, and hand hygiene. The lighting and bed affects the patient's mood. If the lights are broken and the patient cannot see, it creates a dark environment, and it also creates dark emotions and poor health. If the patient isn't comfortable, that increases the chances of irritation and aggression towards others. The nurses are impacted because they cannot provide proper care in a safe environment for the patient. So they too may become overheated and also can be agitated as well because of the heat. Recommendations and measures for success. I recommend a patient exit check for it. So whenever the patient leaves the room, while the room is being cleaned, the appropriate team member can check the utilities to ensure they are in proper working conditions. That's like checking the restrooms, making sure that the toilet works, making sure that the shower works and the water is running, that there's no cracks, making sure that the lighting in the room is clear enough and that all the light bulbs and everything is working, making sure that the call light works, making sure that the bed is functioning properly. Those affects the patient's well-being. And then a patient entrance room check should be completed if the room has been unoccupied for days. They can go in and make sure that everything is still functioning properly. This will reduce the daily complaints from 10 to 7 or less. 2, practicum student learning outcomes and how they were met. So number 7, apply knowledge of legal, ethical, and regulatory frameworks within a specific healthcare environment. It's bringing awareness to the environmental risk, enhances the patient's outcomes while promoting best practices that promotes the patient's well-being and safety. I am ensuring that the hospital remains compliant with guidelines and regulations, which helps reduce liability, risk, and avoid fines and penalties by talking about these risks. Okay. Number 8 is demonstrate nursing management principles using clinical reasoning and clinical judgment, quality, and culturally sensitive care for diverse populations. I am a member of the professional and interprofessional team by planning and providing a solution to the environmental risk of the faulty overhead communication speaker threatening a group of patients. I coordinated appropriate interventions by communicating my plan of checking the overhead system twice daily. I also use the EBP recommendations and organizational protocols to maintain patient safety. And here's the reference list that I use. I cited the Joint Commission because I used the communication EM 12.02.1 EP4. Thank you for the opportunity to present this presentation to you. Have a great day.